Actually, the two words root canal can strike up fear in any of us. But with today's advanced technology, a root canal is relatively pain-free, and it doesn't take as long as it used to. So if you're about to have a root canal, or if you're just interested in knowing what happens during the procedure, this video can hopefully inform and put you at ease. But I have to warn you, if you're at all squeamish about pointy dental instruments at work or a little bit of blood, maybe this video isn't for you. But if it is, let's get started with Dr. Richard Gangwisch.
I chose this tooth because the patient had fractured his tooth all the way down to the gum line, which provides with a very remarkable opportunity to be able to see how a root canal is done. What we have now is we're going ahead and opening up the tooth because we have to be able to expose the nerve so that we can go in and clean everything out. When we clean those out, that's basically the root canal itself that you're going to be seeing here shortly. There we go. Now we've got to identify the canals. That's just a little probe there to kind of see where we're at. Then we take an instrument that's a rotary instrument. We go into the canals and open them up a little bit so we can have the ability to get down there. Now, this canal goes all the way through the root out into the bone. Now we've got a little instrument. It's called a file. And we attach that little probe there with an electronic device that we can actually determine the length of the tooth. So we clean it up, check again, still can't get down that darn canal. So we're going to have to continue on that. We open that up a little bit. There we go again, opening up a little bit more. Have to be able to have plenty of access to do that. Now normally we have to pretty much drill through little tiny openings in the tooth. This is a great opportunity to be able to see exactly what goes on that. Here we go, take the file down again. And we'll clamp the electronic, we call it an apex locator. And still have to get down a little further. Got to work that little tiny file. That file is so tiny, and that's the type of problems that we have with those canals, trying to get down that last little bit. So now we take an irrigating solution. That's material. It's basically sodium hypochlorite, and that's able to clean out all that debris, dead tissue, live tissue, anything that's in the way that we have to clean it out real good. So now we've got some files in there, and we're going to take an x-ray, and that's how we finally determine our final length. So now we know our length, so we're going to go ahead and clean that out real good. Now what we do is take a series of these files that are these are nickel titanium space-aged metals in there, and we go in, just periodically change and stop and clean everything out, go back in. It's kind of a slow process, but it's not bad. Now the good news is you notice the patient doesn't feel a thing, so that works great. Everyone's all concerned about having a root canal done. As you can tell, the patient isn't even flinching at all, doesn't feel a thing. So as you notice, that canal is getting bigger and bigger, and we're able to get further down, further down. What we're doing now is we're cleaning and shaping all that area so that we'll be able to go ahead and get every single bit of debris out of there. So we're getting close at this point. Modern technology is much better than the old days. We used to have to go in with hand files and clean everything out that way. All right, now we've got basically a little agitator that takes that irrigating solution and mixes it up real good and helps dissolve more and more tissue that's hiding up in little nooks and crannies in there. Now these little white things are called paper points, and that's exactly what they are. They're points of paper. And what we're doing now is taking all that irrigating solution and we're drying that up. because we have to have a perfectly dry canal. We want to make sure there's no moisture, no blood at the end, and it looks like it's coming along real good on that. Now the pink things are called gutta percha, and what that is, it's some type of resonance substance that's found in some tree in Peru. So it's very biocompatible, and what we do is we put that in. We have a little white sealer. You saw that kind of ooze out there, and what we're doing there is taking heat and pushing that down to the bottom of the apex, which is the end of the root. Now we're going to go and pack that in real good, and that gets that into all the little spaces there right at the end of the root. Got to seal that up real good. Now we're going to go into the other canal. This particular tooth has 2 canals. See the white sealer on there? That's going to seal a lot of the little areas that we end up needing to get. There's a lot of little offshoots to the canal. Same thing here. We've got the heat. We're going to go ahead and pack that down there real good so we can get a good seal on that. That's what's going to make for a long-lasting root canal for that. And we're going to go ahead and pack that in real good too. Alright, now we're going to do what we call a backfill. We've already gotten the ends of the roots taken care of, and now we're going to go ahead and fill everything up and make sure it's good solid fill. Now, sealing the end of the canal is the important thing. If you can go ahead and clean all that debris out and seal it, then the body doesn't realize that there's no nerve inside, so it retains tooth, and that way that gives us the ability to save teeth. And you can see all that, that's extra gutta percha. Now we'll go ahead and pack that in real good. Same thing, you notice that patient isn't flinching at all, doesn't feel a thing. And we just go ahead and apply a little bit of temporary material over the top of that, and this tooth will be ready to put a crown on next appointment. And there we go, that's what a finished root canal looks like, totally pain-free.